friends, welcome to Daktari Explains. I am excited to be here doing this medical video. It's been 2 months since I lastly did one. Well, internship started, so yeah. But today's discussion is simple and straightforward: pulmonary tuberculosis. Now, TB in itself is a very wide disease, given that it can basically affect every single tissue and organ in your body, well, except the hair and the nails. So yeah, but when we say now pulmonary TB, we are simply focusing on the infection inside the lungs. And yes, but in today's discussion, we are not going to go into the pathophysiology. With that means going into how you acquire the infection. We know it's respiratory, how the infection works to give you the disease and the entire cause of the disease. That is not the point. The point here today is very simple. Finish your anti-TBs. That's just it. If you are currently having the disease and you've been taking your medications, please finish your medications. If you know someone who has TB, please share with them this video and encourage them to finish the TB. TB is very curable. People have taken their medications for 6 months and live their lives as if it was just an event, as it should be. However, what has pushed me to do this video is having lost a 20-year-old girl. And here is the chest x-ray. She was started on anti-TBs, and for some reason, while she was still in her intensive phase. What does that mean? Intensive phase is where you're taking all 4 medicines in one tablet, but you basically have the 4 types of drugs inside, which is rifampicin, isoniazid, pyrazinamide, and ethambutol. Well, simply put, RHZE. So intensive phase is when you're taking all this, and then continuation phase, you just take rifampicin and isoniazid RH. Now, patient starts the anti-TBs, and for some reason, like I said, she stopped while still in her intensive phase. What that simply means is you've already told the infection, I'm here to attack you because you've started the medicines. Then you take them for some time and you're trying to bring down the infection and destroy the organisms. Then you stop while the organisms are still quite active because you've not yet fully destroyed them in that intensive phase. Then you stop your medications. Like any warfare, if you do that, you leave the enemy planning themselves better, getting stronger, and fighting to take you down as fast as possible. Because when the medicines are restarted, oftentimes you'll just be started on the same medications. It's not like you'll be given a different formulation. So you find a more resistant infection that has really destroyed your tissues, bringing about what we call fibrosis or scarring of your lungs, like how you simply understand a scar, like a scar tissue when you cut yourself and you have a scar left. That is exactly what happens in the lungs. When those medications are stopped, your immune system will definitely try to deal with that organism by itself. During that inflammatory period, which is the immune system trying to deal with it, a lot of other cells are damaged. It's a typical warfare. A lot of damage is being done. A lot of white cells, everyone is being sent there to try and deal with these organisms. And after that, all this fibrous tissue develops. Like in this chest x-ray, it was bilateral TB, meaning both lungs are affected. So that's the first issue. And then a lot of scarring had happened to the point actually it was now more like an interstitial lung disease, where it's just a lot of scarring. To put it simply, as my goal is to keep this video very short today, this little girl had very little lung tissue left to survive with. Once your lungs are affected, your heart is affected, because basically we know that the heart will pump the blood to the lungs for oxygenation to happen, and then back to the heart, and then the heart will send the blood back to the entire body, and the cycle continues. So once your lungs are this damaged, the pressures, I said I'm not going to the pathophysiology, which is how the whole disease happens. But basically, put it simple, is once your lungs are this damaged, your heart is also really compromised in many other organs. And yes, so in this particular case, we actually lost this patient. And I hope to relay this message very clear. If you are having a relative on anti-TBs, encourage them to not break those medications, basically break from taking, but they should take them as consistently. I mean, it's just, we take them OD. OD means once a day, maybe it's 3 tablets, depending with the weight and how it was calculated, but make them as part of your meal if you need to, so that you can just take them as you move on with your activities, because you will get cured and you live your life comfortably. Don't stigmatize your loved ones who might be around with the TB. If they're in the acute phase, like the first 2 weeks to 3 weeks of the medications, please keep yourself safe. That is, allow them to get their isolation period. So because that is, they can really spread the disease at that point. But once they get into their 4th week and continuing, you can start some interactions here and there. So that is my simple message today. Finish your anti-TBs or tuberculosis medications and save your life, live your life comfortably and fully as it should be. More importantly, like we say, in the health industry, we treat, God heals. So let him know about your disease, let him know how you're faring on, because ultimately he's our healer to all of us, even us doctors. So be encouraged, enjoy yourself from wherever you're watching me from. Remember to like, subscribe, and share. Bye-bye.